Hello, my name is Jamila Bugazi, and I'll be talking about how technology changed the nature of the clinical encounter for cystic fibrosis. So, as we discussed before, wearables truly changed the future of technology. Specifically for cystic fibrosis, home based technologies and wearables could be integrated for um, patients' care later on. So, there are three categories that could be envisioned to restructure the care activity system of people with cystic fibrosis. And this includes data augmentation of existing clinics, remote triage, and remote clinics. So the only difference is that for data augmentation, there's little change in the overall structure of the care cycle. With technology, there's more information available for doctors through wearables. However, in a triage-based system, it's different because now patients can video call their specialist for cystic fibrosis, and in remote clinics, nurses can be contacted to make appointments remotely, and this would make care more accessible to patients with cystic fibrosis.
So today I'm going to talk about the article Potential Technology to Improve Cystic Fibrosis Care Provision. So cystic fibrosis is a chronic disease that has been monitored throughout the patient's lives. It is a disease that causes the patient to experience burden in their everyday lives. And on top of that, they need to make many trips to the hospital, and each visit takes a very long time to provide care for their condition. So, due to the chronic nature of the cystic fibrosis, we need to consider carefully when designing technology that could help monitor the patient condition while at home, because this will reduce unnecessary visits to the hospitals. Many patients describe hospital visit for cystic fibrosis as inconvenience, time consuming, and then simply boring. So hospital visits can also bring negative feelings for the patient due to past negative association with the hospital. So thus, to design a self-monitor technology for cystic fibrosis patient, we need to utilize collaborative work between patients and the clinics. For an example, patient can self-monitor their condition using the technology while at home every day. Then they can make a visit to the hospital every time that is necessary to provide data to their healthcare providers. So this would result in an efficient monitoring of the cystic fibrosis condition for both the patient and the clinics.
I'll be discussing Article 2 and specifically about how the perceived value in technology for cystic fibrosis care. So, both patients and clinical professionals felt that wearable and home based technologies could fundamentally change the nature of cystic fibrosis care. So, some members explained how the regular cadence of visits for cystic fibrosis highlighted the importance of early identification and the treatment of the decline of a patient's health. So, one clinician said anecdotally that 8 out of 10 patients were stable and well, meaning that 2 should have attended a hospital sooner. Therefore, clinicians perceive significant value in technology that could remotely monitor the core health metrics of a patient, such as their lung capacity, weight, and body mass index, to allow for early identification of those becoming unwell. Additionally, the benefit of these technologies was not simply that they enabled more frequent measurements, but they also supported introspection of patients' own health and caused them to think about it as they were taking these metrics, in addition to just providing numbers. Also, patients were enthusiastic about the possibility of these new technologies in an effort to reduce the possible visits that they would have to eventually make to a clinic.
Hi, I'm Nancy, and I'm going to be discussing Article 2 Patient Experience is Evolving as Providers Embrace Telehealth Summary and Opinion. Due to lack of staffing and efficiency, telehealth programs are ways to reach more patients in a shorter amount of time. This allows both inpatient and outpatient specialist consultation, specifically allowing for long distance patient and clinical contact. One of the largest limitations of the use of telehealth is patients' preference for face-to-face interactions. This may be caused due to lack of access to video-enabled devices, lack of confidence in virtual care, lack of technological knowledge, lack of reliable service and internet, and the concern of the quality of the care. On the bright side, telehealth is virtually improving by the minute, as well as a slow increase of patients willing to work with it. The overall goal of the telehealth system is to make primary care doctors into virtualists who are going to take care of hyper convenient care. For instance, ambulatory care situations will be handled in the patient's home. The important thing to highlight, as the article states, is that the adoption of telehealth programs is rapidly growing, making health a more convenient and accessible tool for certain patients to access. In my personal opinion, I believe this method of healthcare would be inconvenient for large populations of people, including people who lack technological access, as well as patients' uncomfortability with the software. This separates healthcare into even more of an economic issue, separating the low SES patients from the wealthy. It is difficult to imagine people who need a lot of medical attention being comfortable with the idea of virtually attending doctor appointments. Overall, I do not believe the system would receive good feedback from either patients or doctors.
Hello, I'm going to be talking about the article where a patient's experience is evolving as a provider embraces telehealth. I think using the methodology of telehealth program allows patients and new incoming users to reach specialists in consultations. The main use of this function is to allow easy accessibility for patients who have difficult contact with healthcare providers and services, and especially for those who have no means of transportation. This is one of the prominent examples that we discussed in lecture that is represented by one-on-one physician care with easier accessibility. The notion of live data feedback from patients to doctors can be utilized through this method. To mention also as well, while some limitations include lack of access to videos and camera devices, over 64% of health systems and hospitals started to offer this method of care, and the pace of adopting telehealth care is accelerating and increasing at a rapid pace. Personally, I think this implementation does offer a method of convenience. However, I do think that it's still quite young and that there are other methods in mitigating the issues of inaccessibilities to doctors, such as providing transportation and even expansion of medical care that would cause more trouble than great in this case.